We thought it would be best to go straight to some of our lawmakers, a couple of congressmen.
Yes, we are welcoming in studio this morning Congressman Ami Bera and also Congressman Tom McClintock. Good morning to both of you.
Good morning. Good morning.
Why don't we start with the possibility of the spending plan shutting down the federal government? If you had to take odds right now, Congressman McClintock, what's the likelihood of the government shutdown?
Well, nobody wants to see a government shut down or a government default, and the House has passed legislation to assure that doesn't happen. But we also have a health care train wreck coming down at us that we've got to deal with. I'm getting frantic calls from folks that are seeing huge increases in their premiums, they're watching their plans being dropped, or they're seeing their hours cut back at work. This is something we can't simply pretend isn't happening.
Okay.
And what I'd say is I'd agree with Tom that this is not a way to do business in terms of shutting the government down. Fundamentally, though, the problem is Congress has not passed a budget in years. And I ran on no budget, no pay. We've got to pass the budget, and we've got to get Democrats and Republicans, the House and the Senate, sitting down together, putting together a responsible budget that starts to address our debt and the deficit. It's not a way to run government just by kicking the can down every 2 or 3 months, every 6 months. Let's actually come together as elected representatives. We're in divided government, and we should be able to put everything on the table, deal with health care, deal with our debt and our deficit, start rebuilding a public education system, and get this done.
But neither of you answered the question. Percentage of this happening before October 1st, what do you think?
My hope is that we do what we were elected to do and come together and don't make our veterans suffer, don't make the small business owners suffer.
Will you give me a number?
Percentage?
I have no powers of prophecy, Dan. I can't read minds and I can't tell fortunes. But I do agree with Ami that the House is designed to operate independently of the Senate. The House exercises its best judgment. It did this past week when it passed the legislation to keep the government from shutting down. The Senate will exercise its best judgment this week, and then the two sides are supposed to get together and negotiate any differences. But the problem is Senator Reid and the President have both said they refuse to negotiate on this issue. So that's the problem, and I don't know what lies down the road from there.
But wouldn't you both agree that it is past time that something has to be done to put America in this position to face another possible government shutdown? Two sides have to come together at some point and
they do, and they've got to deal with this train wreck, and that's not my term, that's the term that Max Baucus, the Senate author of Obamacare, has given it. It is developing all sorts of unintended consequences. We were told it was going to bend the cost curve down. Instead, we're finding it's going to cost $641 billion more. That's about $7,500 per family more over the next 8 years than we'd be paying without it. We were told that it was going to be good for the economy. Now millions of people are losing their jobs or seeing their hours cut back as a result of it. We were told if you like your plan, you can keep it. People are now getting notices that their employers dropping their health plan. Home Depot just announced 20,000 people losing their health care because of Obamacare.
But Congressman,
we've got to deal with it.
It's the law, and we had an election last year where it was very clear. One candidate said, I'll repeal it. The other said, I'll keep it. And the American people spoke. Why does that not matter?
And the American people now, by growing margins, are saying they need us to deal with this because it is creating enormous pain for folks.
Here's how I'd look at it as a doctor. I've been consistent. This is not the piece of legislation that I would have put together, but as you just pointed out, Dan, it now is the law. The Supreme Court's ruled on it. Let's take it and let's fix it. And that is exactly what I've been working on. Working with Republicans, say, okay, let's have some liability protections in there. I look at that as a doctor. Let's start to bend the cost curve. That's what we should have focused on first. But again, this is a law. There's a framework. Let's start addressing the cost of healthcare, because talk to any individual, small business owner, big business owner. For years, they've been paying more and more every year, getting less and less. So that's not sustainable. But we've got a framework now. It is the law. Let's actually fix it, and let's make it better, and let's make it about patients.
So well, actually, Republicans, but just worth some adjustments.
Republicans have just offered a complete alternative to Obamacare that keeps the patients in charge of their own health care. It extends to
when
individuals.
Did that come out?
Well, actually, it was first introduced during the debate on Obamacare, but it's just been reintroduced this past week. It extends the tax benefits and breaks that we currently give to employers to buy health care for their employees. We give those tax breaks to the employees themselves so they can shop around for the best plan to meet their own family's needs, that they can own, that they can control, that they can hire and fire. It expands the health savings account so that people can pay for their costs with pre-tax max income. It goes after the cost drivers like medical liability. It extends to people the freedom to shop across state lines to choose the plan that best meets their own needs at a price they can afford. It basically puts the patient back in charge of their own health care again, which is where they should be.
Because one of the things that we've heard during this debate is the people are not in favor of Obamacare. That's one of the things we've heard from Republicans many times. If we're listening to the people, why is it that we listen to them on this, but we didn't listen to them on gun control when everything said that they wanted things done? Do you selectively pick when you listen?
Here's what I'd also say. Overwhelmingly, 3-1, the people don't want to take fixing the Affordable Care Act and tie it with funding our government.
Right.
They overwhelmingly say, those are two separate issues. Funding government, dealing with the debt ceiling is all about putting together a responsible budget, coming together, and Congress has failed for years to put a budget together and pass a budget. How can you actually set what our priorities are? How we're going to use the taxpayers' dollars without actually having a budget? And that's where Congress is falling down. And that isn't Democrat versus Republican. Right. You can point the finger all over the place. What we need to do is sit down and learn how to negotiate in divided government.
But Amy, this is the point. We've got a House plan. We're about to have a Senate plan this week. They're going to have to be negotiated, and yet the Senate Majority Leader and the President are saying they refuse to negotiate. Well, how can you run a government like that?
That's because you tied it together with the Affordable Care Act. So if these are two separate issues, the House has passed a budget, the Senate's passed a budget. They're $100 billion apart. Now, the Senate's appointed individuals to go negotiate. The House has not. And the way this should work is they then go to conference, they work it out. How can you put a budget together when you have two separate budgets that are $100 billion apart? Come together with a single number, and then we can actually go through the regular order, the committees working together to appropriate and set our priorities. But we've got to have a single number that we're working with.
And Ami, when it comes to Republicans and Democrats trying to agree, Republicans want cuts. Are there cuts that you are willing to make?
Absolutely. There's no way to deal with the debt and the deficit without actually putting everything on the table. That's why the president didn't take the recommendations of his own budget committee. I think the Simpson Bowles, at a minimum, should be used as a
starting point. But it doesn't include the Affordable Care Act.
Absolutely. There's no way to address the debt and the deficit without addressing the cost of health care. And when I talk about how this is not the piece of legislation I would have started with, I would have started addressing the cost first. The president chose to address access to care first. That said, it is now the law. So instead of relitigating the past, let's actually take this law, let's fix it, let's make it about patients and make it better.
Can we separate the two?
You can't ignore the 800-pound gorilla that's in the room right now. What has been a distant theoretical discussion over Obamacare is now becoming a very personal, very practical problem, as it is impacting millions of American families who are losing their health plans, who are seeing their premiums absolutely skyrocket, in some cases triple, who are seeing their work hours cut back, all now as a direct result of this. We have got to deal with this. We've been delaying action on this for the last several years. Republicans have been warning that this train wreck was barreling down on us. Now it's here, and we've got to deal with it.
But if we deal with the reality here in California, the health insurance exchanges and the rates that have first been announced are a lot lower than people expected. And in fact, you're seeing business owners sit there and say, hey, look, costs are a lot cheaper on the exchange. Let's actually start making sure that we keep those costs down.
Ami, I don't know who you're hearing from, but my constituents are saying exactly the opposite. Last week, I got over 1,200 phone calls in opposition to Obamacare, a lot of them frantic because they had just seen their health premiums absolutely skyrocket.
Well, again, what we're doing is we're creating a robust marketplace. Part of the reason why healthcare costs go up and up is the number of uninsured that are kind of free riders on healthcare that when they get in an accident, we have to take care of them.
It's not a robust marketplace under Obamacare. It's the same choice that Henry Ford offered with the color of the Model T. He said you can have any color you want as long as it's black. You're destroying a robust
Congressman, the cost was going up even before Obamacare came. What's different? It's just the rate that it's going up?
Yes, precisely right. If you compare health care costs in the United States compared with the other industrialized countries, our health care costs were going up much more slowly than the rest of the industrialized world until Obamacare. And once Obamacare hit, it's now going up much faster than the rest of the industrialized world. It's true. It is true.
I don't buy that. I think you're going to see state-by-state differences. But let's bring it back to the original issue here, which is keeping government working. So I'm very much open to saying, let's look at the Affordable Care Act, let's put our best ideas on the table, and let's figure out how to actually bend the cost curve and make the costs come down.
With
in
you
healthcare.
two on very different
But-
sides of the table, how do we do that in the next few days to avoid a
Well,
government
what I'd say
shutdown?
is they're two very different issues. What you're doing is you're holding hostage, benefits that veterans receive. You're holding hostage. Our men and women in the service are going to have to continue reporting to duty, but they're not going to get paid.
So you're saying separate the issues.
But Ami, we passed a bill to assure they get paid, and you voted against it.
No, you're holding the Affordable Care Act hostage. So
No, we're saying fund the entire government, including the troops, including every program that we may disagree
And
with.
defund the Affordable
But we've
Care
got
Act.
to deal
Right.
with Obamacare at the same time. And the only way to do that is for the House and the Senate to come together and negotiate their differences, but Harry Reid is refusing to do
Well,
so.
and the House is tying these two together in a way that's holding hostage veterans, holding hostage our active duty military, holding hostage small
We
businesses.
just voted to fund all of that. You voted against it.
No, the majority of the public wants to address these as two separate issues. I'm more than happy to talk about how we fix the Affordable Care Act, how we make this about driving costs down. But the real issue with this kick the can down mentality is we don't have a budget. And I think, Tom, you and I could agree that first and foremost in our job in Congress is to pass a responsible
That's true,
budget.
and we have for the past 3 years. And I don't recall how you voted on it, but I suspect you voted against it. I'm on the Budget Committee. I helped write those budgets. The problem is getting cooperation with the Senate.
Right, but the problem with the House and the Senate, in divided government, you have a Democratic Senate, you have a Democratic president, and you have a Republican House.
Which is why negotiations are so important and why it is absolutely inexcusable that the president,
Tom, you're on the budget.
who's apparently willing to negotiate with Iran, refuses to negotiate on on a matter that is absolutely crushing the health care for working people
Tom, you're on the
across
Budget
America.
Committee. Have you guys appointed folks to go to conference with the Senate? I know the Senate's and then has the House actually appointed conferees?
The House has made it very clear it will appoint conferees as soon as a structure can be agreed to, but we can't get that agreement.
Well,
We
Seems like
can't agree
that's-
on this.
right.
It's the butting of heads that continues. You're going back to Washington tonight, tomorrow?
Tomorrow morning.
And same thing?
we'll probably be on the same
On the
flight,
same flight?
so we'll
Right.
keep
Maybe
talking.
you guys could sit together and
A
talk
lot
this out
of
a little
work
bit
to be
more.
done
Yeah.
in the next few days.
We're going to post some of this on our website. A very interesting discussion.
Thank you.
Congressman
My
McClintock,
pleasure.
Congressman Barrett, thank you
you.
so much.
Absolutely, glad.